How you doing, guys and gals? It's Doug Wilson from Yellowhawk Customs Outdoors, and another installment of Bob, the Grizz, right? So Bob's been, when he was in the Navy, he was a Navy corpsman, medic in the military. He worked in an operating room he just retired as a first assist in an operating room. So this guy here knows more about medicine than most doctors, okay? No shit. All right, so I'm going to turn it over to him. He's going to give like some basic first aid tips. All right, stay tuned.
Hey, good to see you guys again. We're going to talk a little bit about basic first aid in the field. I just want to let you guys know I'm not a doctor, I'm not a PA, I'm not a nurse. You know, as Doug said, I was a Navy corpsman during Vietnam. I was an Army medic during like the whole Desert Storm thing, and I was also a medical service corps officer. Yada yada yada. I worked in an operating room for 44 some odd years as a first assist, as a surgical, actual surgical technologist, and whatever. So I have a lot of first aid experience. I was a first aid merit badge counselor. I had basic and advanced first aid through the Red Cross. So these are sort of things that I use. There's also wilderness first aid you guys can take now, of course. So this isn't all inclusive. If you want to learn about these things, go take a EMT course or go take a first aid course through your local Red Cross. Okay. When you're in the woods, there's some really basic things that may happen to you. Okay. First of all is prior planning. Anywhere you go, you should have a plan or event plan at home where your wife or your husband might know where you are, emergency phone numbers, that sort of thing. And now with the advent of cell phones, we can hit 911 real quick. We're usually near a volunteer fire department or a hospital. So getting evacuated and out of an area when you're injured, unless you're really in the true wilderness, is not easy, but it's pretty easy. Okay, so you always put a planning event. If you're going to go anywhere for longer than a weekend, like my wife has Doug's phone number. She has the shelter where we're at, what state we're in, and so forth. That's prior planning prevents piss poor performance. Okay, that's an old military adage. Okay, anyway. Some of the things that you're going to find in the woods are just really simple. So I got an audience here that's going to ask me some questions, and we'll talk about that first before I get into this little first aid kit, which I never carry. In all my life that I've been in the woods, I've only ever carried Band-Aids. That's about it. Okay. So I open this to our studio audience. What's the first question from our studio audience?
Okay, Bob. A lot of the campers that go out, some of them don't like going in this cold weather, and bugs usually aren't a problem. But during the summer months, there's a lot of guys that like that fair weather camping. How do you handle bug bites? What's all the different types of bug bites?
Okay. Well, bug bites, basically if you wear a good bug bite juice, bug juice or whatever, you may not get them. Okay, that sort of thing. But yeah, you'll get mosquitoes, you'll get black flies, you may get ticks. If you're really have bad luck, you might get the brown recluse, you might get the black widow, you might get scorpions, so forth. Okay, you might get snake bites. Okay, so we're just going to talk about basic insect bites, and this is something you carry around with you to take care of a bite. For you cigarette smokers or you pipe smokers or cigar smokers, all you have to do is take the tobacco, wet it a little bit, make a poultice, and that creates an astringent. It's vasoconstrictive. It pulls the venom or the irritation to the surface of the skin, and it helps alleviate your itching and your inflammation. Another thing you can use is mud. You take a mud poultice or pack and put it on the affected area. Also toothpaste. You take toothpaste, put it on the bite, it dries, it pulls, works as an astringent, and pulls that, actually they're enzymes that the body reacts to in the skin and pulls them out. Okay. Talk about snake bites. You have to be an identifier of snakes in the area. If it's a poisonous snake, if it's not a poisonous snake. Usually the poisonous snakes have sacs, which makes their heads look like an arrowhead, pretty much. Okay. And around here we have the copperhead, we have the timber rattler, sometimes a water moccasin as we go further south. Other than that, we don't really have a lot of big snakes here, and that's why we like camping in the winter, because they're all hiding. Okay, so with the snake bites, you know, the general adage for that is keep it lower than the bite, the extremity, wherever you're lower than the bite, and just cover it and get your ass to a hospital.
Lower than the heart.
Yeah, lower than the heart, so they can get you to the anti-venom at a hospital. So you don't want to raise it; you want to keep it lower than the heart or the chest. Same way with brown recluses and black widow bites and things that they need to ice them. You know, keep them, just bandage them up, treat them like a regular puncture wound or cut, ice them, and get yourself to a hospital. Okay, anything more than that, whatever, you know, you can read up on it. Okay, so in the bite area, that's about chamomile. What is it called? What's the brown crap you used to put on your when you had bites, or poison ivy? Same thing. Another histamine.
Calamine lotion.
Calamine lotion. Something you might take with you.
Or zero drill.
Yeah, something like that. Okay.
What's that
All right.
tar stuff?
What's that now?
Green stuff.
He was talking about the dark brown stuff, that tar-like.
No,
Well,
he's talking about calamine.
I'm talking about calamine lotion. Okay. So anyway, that's a simple thing on bites. And any other questions?
How about blood flow? If you're you're out you're hiking on the trail or something like that, you fall, you bust your knee open, or you're trying to sharpen a knife, you slip, you cut yourself. How do you handle controlled bleeding?
Okay. For the most part, I tell you, Band-Aids work great. I mean, wash it with soap and water. Ivory soap, any type of soap works well. There's Dr. Bonner's liquid soap. You can do everything with it. Brush your teeth, wash your hair, douche with it, everything. You can do everything with Dr. Bonner. It's a Castile soap. Okay, it's true. It says so on the bottle. Okay, you can do a lot with it. Okay, it's concentrated. So what you want to do, salt. You mix up a salt mixture and use it if you have some salt packets with you. If you have chlorination tablets for your water, you can pound them up and put them in a slurry and wash your wound out that way. You can also bring iodine, if you have liquid iodine, or even the tablets, but liquid iodine is better, and you can put it in a little bit of water, slurry it down, and rinse and irrigate a wound. A wound you always want to make irrigated, and if it's a puncture wound, you want to make it bleed. Okay, not so much that you have, you might have to put a tourniquet on it. Okay, but you want to make the puncture wound bleed, because it takes the bacteria of a point and drives it deep within your soft tissue, and so the end point is where bacteria usually festers. So the blood in itself works as an irrigant to wash the bacteria up to the outside. Okay, then you just want to clean, use a Band-Aid or whatever. Now, another unique thing that I've used before in the military is tampons. Okay, we wet them in salt water. They have a string on them. Wrap them around a big toe and tie them off with a square knot or whatever. Also, Kotex. Rather than buying these big battle dressings and things of that nature, get yourself the heavy flow day Kotexes, and you can get them in different levels too for different days and different thicknesses. They work great. It's like abdominal bindings or abdominal. You just need an ace wrap, or you just need a gauze piece here to wrap it around and hold it on, or just tape. Duct tape is another thing you may carry with you that's used for taping and so forth.
I carried Kotex tampons in my aide bag.
Okay.
For bleeds. Yep.
So the other thing is you might have a go-to-hell rag or just a sweatband or a rag that you can make into a bandage, tie around, so forth, and also will be used for splinting. A lot of guys are carrying the shema. You can make a sling out of this, and you can also use it as a bandage. Okay. So what you have on your body and what you bring normally, like I've always said, should have at least two purposes, or maybe even three. Now on uncontrolled bleeding, like if you have a big axe cut, or you dig into the limb, then you might want to put a constricting band if you have a lot of bleeding. It's a judgment call. Okay, you don't put a tourniquet, you put a constricting band 4 to 6 inches above the injury. Okay, and what do you have on you to do that? You have your belt. Okay, a lot of guys wear the military belts that are about 2 inches wide and so forth and so on, and so they can use that just to get it to the bleeding slows down a little bit, and then you bandage it and elevate it, okay, to stop the bleeding. If it starts to bleed through, then I wouldn't tighten down the constricting band. This isn't a tourniquet. This doesn't have a twisty and put compression on the extremity. It just puts pressure around the extremity, so the muscles and all will contract and kind of hold the vessel, so the vessel itself, when it's cut, will usually stop bleeding, okay, and it'll shrink, all right? So, that being said, a lot of guys now are carrying these cat tourniquets and all. If you don't know how to use this and you've never used it, these are dangerous, okay? This is only for life and limb, okay? When you know the guy's going to go into shock, remember shock, face is pale, raise the tail, face is red, raise the head, okay? And keep them warm. And don't give them any liquids if they're not conscious, okay? All right? So these can be dangerous if you don't know how to use a tourniquet, all right? I see all these guys with these, high speed, OD green pouches, and they all think they're medics and so forth and so on. Quick clot, I have a quick clot bandage here, which you could use, The Israeli bandage is a pretty neat reusable bandage, so forth. Another thing for simple fingers, you can use some steri strips and mastisol or a liquid adhesive, like so. And some steri strips, do a butterfly type of bandaging on your finger or your toe, whatever. One thing that it's carry some cotton swabs, Lister bandage scissors, or the EMT bandage scissors, for cutting things. But one thing that's really overlooked sometimes is dental emergencies, okay? If you have a tooth knocked out or whatever, you want to put it in a cup, a little bit of saline water that you can make up, or just dry, and keep it to see if it can be reimplanted, okay? You can buy this at your local store. This is called Soft Brush Gel, and it's made for the same people who do like cold sores. It's an oral astringent and a anesthetic, so if you have a toothache, you can just drop this gel on the toothache and it'll dull it. Also, oil of clove will do the same thing. Also, a wet tea bag, if you're a tea bag drinker, which I am, you can wet the tea bag and shove it in the corner of your mouth. That the tea works as a vasoconstrictor, and it doesn't allow the gum to swell and to give you that inflammation and pain, okay? But you can buy these. They're a brush and a gel over the counter. Another thing you can do is, we had this with Doug last one we went to. He had a filling come out. Well, here's an actual paste for fillings and loose caps that you can make up, and you can place it over top of the gap or the hole within the tooth, okay? They even have an applicator here, okay? I also got myself a dental pick and a mirror for those areas way back in the mouth that you can't see. And the dental pick is only just to test the nerve to see, does this hurt? or to pull some extraneous tissue that's caught in there out of between the teeth or out of the cavity. So dental emergencies are another thing that people normally don't carry in their first aid kits. Aspirin is a big one, or Aleve, or whatever you can use for an anti-inflammatory is very, very good to have in your first aid kit. But like I said, most of what you need is on you. Basically, Band-Aids, any type of size Band-Aid is probably the best thing that you can carry with you anywhere. In your pocket, they're light, and they will compress, and if you bleed through, you can put another Band-Aid on top of that, okay? Excuse me. So all this, quick clot and all that, that's like trauma. That's really combat oriented, per se. All right? Any other questions?
So let's say you, the possibility of breaking an arm or spraining it to the point where it's immobile, how do you immobilize a limb?
Well, as you know, you have a lot of sticks here in the woods, okay? And you have wide ones, narrow ones, so forth and so on. And you always immobilize a limb above and below the joint, okay? You just don't immobilize it here on the arm if you have a ulnar radius fracture. You make sure you include the hand or the wrist joint and the elbow, okay? Because they all intersect and work with each other, hand bone's connected to the arm bone is connected to the elbow bone. The muscles cross over, the tendons all cross over. So if you immobilize this area, and I see people just put an ace wrap like in one area, like it's supposed to do something. No, everything above and below it is making that area move. So you have to immobilize always above and below. The second thing that you can do is, if you ever carry one of those Ensolite pads, those old blue ones, like the Army had or old backpackers had before they came out with, your actual mats, which you can use also. you can use that and make it into a C, like a cup or a U, and you can place the extremity in it, and you can tie it off with your go-to-hell rags or bandanas or your shema or some cord, some cordage or whatever. That's another way you can immobilize. Also, everybody starts carrying these walking sticks now. Okay, this is another way you can pad them up or put padding in between the leg and these, and you can use these as for a leg or for a femur or so forth and so on. Okay, so there's many ways that you can immobilize an extremity. The other thing is that you want to evac them out. Okay, so how do you get them out? Well, it used to be we had framed packs. You could tie or duct tape frame packs together, put them on a frame pack, and carry them out. You also have tarps now. You can lay them on a tarp and drag them out. Kind of bumpy, but if it's only you and the tarp and him, that's you can get them to a roadside. That's what you have. If you have 3 or 4 guys that can all lift the tarp and carry it at the corners and all, you can carry them out in the tarp. Also in a sleeping bag, if you can treat for shock at the same time you're transporting them, keeping them warm in the sleeping bag and carry them out in the sleeping bag. Okay, so hopefully by that time, when the injury does occur, with your cell phone being fired up real good and charged and everything, and if you have reception, you get that 911 call out and you give your location and where you're going to or coming from or whatever, that hopefully by the time you get to that roadside or that trail, there'll be somebody there to meet you and take care of the injured party. Now, I didn't go over like head injuries and I didn't go over things of that nature, because concussion's a concussion. You just got to get them out, okay? And if you have to evac by helicopter or vehicle, you try to find a place that is spacious, that doesn't have power lines and so forth and so on, so you can land something or you can drive something in there. It's all common sense, okay? So I hope this helped you. I know it's not everything. I might do a follow-up, but if you ever have any questions, just put them in the comments, and I'll see. I always review them, and I'll see what I can do for you, okay? So this is Bob with Grizz Primitives on the Yellowhawk channel, saying, hey, thanks a lot, and be safe.
Okay, guys, so that was Bob on a bit of first aid. We'll see you guys on the next video. Thanks for watching.